But let's start with health care, because this is a critical issue affecting millions and millions of Americans. And Jean, you have a question on that.
Well, you all both mentioned that health care is a priority for your party, but the truth is that most Democrats really do want full coverage, everybody covered. Now, Senator Obama, this is a question for you. Yeah. Under your plan, which is voluntary, it creates incentives for people to buy, but still is voluntary. There would be about 15 million people who would still not be covered. Now, why is your plan superior to hers?
Well, understand who we're talking about here. Every expert who looks at it says anybody who wants health care will be able to get health care under my plan. There won't be anybody out there who wants health care who will not be able to get it. That's point number one. So the estimate is, this is where the 15 million figure comes in, is that there are 15 million people who don't want health care. That's the argument. Now, first of all, I dispute that there are 15 million people out there who don't want it. I believe that there are people who can't afford it, and if we provide them enough subsidies, they will purchase it. Number one. Number two, I mandate coverage for all children. Number three, I say that young people who are the most likely to be healthy but think they're invulnerable and decide I don't need health care, what I'm saying is that insurance companies, and my plan as well, will allow people up to 25 years old to be covered under their parents' plan. So as a consequence, I don't believe that there will be 15 million out there. Now, under any mandate, you're going to have problems with people who don't end up having health coverage. Massachusetts right now embarked on an experiment where they mandated coverage. And by the way, I want to congratulate Governor Schwarzenegger and the Speaker and others who've been trying to do this in California, but I know that those who have looked at it understand. You can mandate it, but there's still going to be people who can't afford it. And if they cannot afford it, then the question is, what are you going to do about it? Are you going to fine them? Are you going to garnish their wages? You know, those are questions that Senator Clinton has not answered with respect to her plan, but I think we can anticipate that there would also be people potentially who are not covered and are actually hurt if they have a mandate imposed on them.
Senator Clinton, this is a substantive difference on health care between the two of you. Go ahead and respond.
Well, let me start by saying that this is the passionate cause of my public service. I started trying to expand health care many years ago, first to children and to rural areas in Arkansas, and obviously tackled it during my husband's administration. And the reason why I have designed a plan that, number one, tells people if you have health insurance and you're happy with it, nothing changes, is because we want to maximize choice for people. So if you are satisfied, you're not one of the people who will necessarily, at this time, take advantage of what I'm offering. But if you are uninsured or underinsured, we will open the Congressional Health Plan to you. And contrary to the description that Barack just gave, we actually will make it affordable for everyone, because my plan lowers costs aggressively, which is important for us all, improves quality for everyone, which is essential, and the way it covers all of those who wish to participate in the congressional plan is that it will provide subsidies. And it will also cap premiums, something that is really important because we want to make sure that it is affordable for all. So when you draw the distinction that, well, it's not affordable, therefore people will have to be made to get it, well, the fact is it has been designed to be affordable with health care tax credits. And it's also important to recognize that right now there are people who could afford health care, and they're not all young. They're people who just don't feel they have to accept that responsibility. There are many states which give families the option of keeping children up till 25 on their policies, but their rates of uninsurance are still very high. We cannot get to universal health care, which I believe is both a core democratic value and an imperative for our country, if we don't do one of three things. Either you can have a single-payer system, or, which I know a lot of people favor, but for many reasons is difficult to achieve, or you can mandate employers. Well, that's also very controversial. Or you can do what I am proposing, which is to have shared responsibility. Now, in Barack's plan, he very clearly says he will mandate that parents get health insurance for their children. So it's not that he is against mandatory provisions, it's that he doesn't think it would be politically acceptable to require that for everyone. I just disagree with that. I think we as Democrats have to be willing to fight for universal health care. And what I concluded when I was looking at this, because I got the same kind of advice, which was, it's controversial, you'll run into all of this buzzsaw, and I've said, been there, done that, but if you don't start by saying you're going to achieve universal health care, you will be nibbled to death. And I think it's imperative that as we move forward in this debate and into the campaign, that we recognize what both John Edwards and I did, that you have to bite this bullet. You have to say, yes, we are going to try to get to universal health care. What I have designed makes it affordable, provides premium caps, so it's never above a small percentage of what individuals are asked to pay.